I'm Keith Corbett, and I'm from Brookings, South Dakota, and I'm retired. I was retaining fluids, and I noticed when I couldn't even get my shoes on, and my ankles were swollen, and so I called my primary care physician, and they got me right in, and he had a number of tests, and I'd put on a lot of weight, and he knew that because I normally exercise pretty heavily, and so it wasn't normal for me. Did a couple more tests, and then he said, I'll give you a call. I went home and just got in the house, and he said, you need to go have a catheter put in. The emergency room is waiting for you. You need to get there within the hour. And so my wife and I headed over here and went through the procedure. I have a large prostate and everything, and they were worried more about my kidneys and everything. That's why they wanted the catheter to drain some of the fluids out until I later had a TURP, which then worked on my prostate. So that catheter helped a lot. My wife and I walked in, and they said, Keith, we were expecting you. They had the insurance already to go, and a nurse came and said, I'm ready for you. And just, there isn't sitting that anxiousness, waiting, and not even certain, what this is going to be. I knew what it was going to be, and went back to the room, and I just said, I want my wife with me because she can hear, and I might not remember what you're saying, and it's just good to have two of us. And they said, absolutely. So they talked to both of us. So a lot of times when, because of the prostate, they had to give me a little bit of a sedation in that area. And so they were telling me, but addressing my wife, sitting there also, and said, Roxy, here's what we're going to be doing. And, and then especially afterwards, Roxy, here's things to observe, procedures you're going to have to follow for the next several days. And just make sure that she was retaining all that information. And she was just, like she was part of the team here, which is pretty important to me. My family be treated the same way as I am. They took it to the level that I could understand and what it was and why they're doing that. And I know our primary care physician does that. And of course, Dr. Bott with urology did that, and the staff to ensure that I understood what the procedures what we're going to do. And that was whether you're in here for EKG or anything. The staff just do a fantastic job of, I don't want to say dumbing it down, but to the level I could understand it. So that meant a lot. From the time I saw Dr. Cecil, probably a week later that I came back in, I'd lost 25 pounds. Yeah. So I could tie my shoes. That was a big thing. But my knees, I have bad knees. I think, the Army made you run a lot, and that probably wasn't helpful. But no, it just losing that 25, maybe 30 pounds. I don't know, because it was 175 in his office that day when I came here. It was under 150. And now I'm back to 140. So, number one, if we don't use them when we need them, they won't be here. The fact that I can drive 10 minutes from our home on the west side of town and be at this healthcare facility, but I also know the level of care here, whether it be the people in support or the nursing staff, the doctors, the administrators, they all care. And I really believe it's from their heart. And just the fact that they care enough to ask you how you're doing and the follow-up from here is just outstanding. And it's not surprising you'll get a call and just ask you, how's everything, and just following up. Because, again, the word ER just kind of scares you. But how fortunate we are to have this facility and the emergency care that's right here in Brookings. And again, the healthcare professionals that are here, it's very comforting. Number one, the level of care you receive here, you're not going to get it anywhere else. The fact is, again, use it or lose it. And we need to retain this wonderful facility and even keep adding on. And you can get about every procedure you need done here. So I don't know why you'd want to travel anywhere and worry about icy roads or, making sure somebody can travel with you and drive with you and just distance when within 10 minutes you can be here from anywhere.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.